Gene therapy, an experimental technique that stretches the boundaries of the treatment and prevention of diseases. It can be used as a solution to previously incurable disease, such as types of cancer, and provides hope to those that had fallen victim. It offers a much more gentle approach to treatment, bypassing countless drugs and surgeries. Gene therapy has the potential to open doors to an entirely new concept of curing disease. Let's look at real-life trials and people who were some of the first in the world to receive the therapy. The Denver resident Rob Girk is the first man in the world to receive gene therapy to restore his hearing. He lost his ability to hear after contracting spinal meningitis when he was 16 months old. His doctor, Dr. Henrik Steiger, was able to modify a common flu-type virus so that it was weakened and used it to transport the CGF166 gene into his inner ear. The goal of inserting this gene was to regenerate cells that could restore the hearing by triggering sensory receptors. Although the treatment is in its early stages, it has a lot of potential, and Rob Girk reported noticing subtle improvements in his hearing.
Nick Tufnell, 38-year-old man, father, husband. At the age of 10, he was diagnosed with a genetic condition, choroideremia, inherited from his grandfather. This is a degenerative eye disease that affects the choroid, a layer of blood vessels that supplies the retina, the light-sensitive layer at the back of the eye. Seeking treatment, he spoke with many doctors, but all of them had the same response. Your son is going to go blind. See you later. With only 10 years left of useful vision, he didn't want to wait for his world to fade around him. Finally, there was a suggestion: gene therapy for the ocular cells in his eyes. In a study at the University of Oxford, he was one of 6 patients to receive virus particles used to deliver the genes in fluid behind the retina. The treatment included an operation that would temporarily detach Tufnell's retina. It's a procedure that is only done in the rarest of circumstances because it can result in permanent damage to the patient's eyesight. If done incorrectly, it could result in immediate blindness. Being as Nick Tufnell was already losing his vision and couldn't see at night, he took the risk. Today, Tufnell is living happily with restored sight. The gene therapy gave him the chance to see his son grow and watch the world change. Thanks to gene therapy, he can live his life.
Bubble boy syndrome is a fatal genetic disorder that targets the immune system and prevents it from functioning. Its victims are male children due to the syndrome being sex-linked, and those that inherit the syndrome will typically not survive to the age of 1. Within their short lifespan, the children are forced into a sterile, lonely bubble that limits their interaction with others. This was previously treated with chemotherapy or extracting bone marrow from donors. However, new breakthroughs suggest that gene therapy might be a more gentle solution. In a clinical trial, 9 male babies were given a healthy version of the faulty gene that causes the disease, and was inserted into them by extracting their bone marrow and using a virus to transfer the gene. 8 out of the 9 boys were still alive 43 months after the treatment, and the 1 boy died only due to an infection that occurred before the trial. This treatment could extend its reaches to other diseases, such as sickle cell anemia.
As you can see from these stories, gene therapy is a process that can save people from horrible things: blindness, deafness, a non-functioning immune system. Gene therapy led to a happy ending for those condemned to disorders that could limit the quality of a life.
Gene therapy gave them a second chance.